Hello and welcome everyone. This is Dr. Hani Nadeem. In this lecture, we are going to study the anatomy of the radial nerve and the cutaneous supply of the upper limb. Uh, by the end of this lecture, you're supposed to describe the anatomy of the radial nerve regarding its origin and root value, its course, its branches, and its lesions, the causes of the lesion, and its motor and sensory effects. The second part of this lecture deals with the summary of the cutaneous nerves of the upper limb. The radial nerve arises from the posterior cord of brachial plexus. That's why it takes all the root values of the plexus from C5 till T1. In the axilla, it descends behind the axillary and brachial arteries. Then it passes in the lower triangular space between the long head of triceps, shaft of humerus, and teres major, accompanied by the profunda brachii artery to reach the spiral groove. In the arm, it runs in the spiral groove with the profunda artery till the middle of the arm, where it pierces the lateral intermuscular septum. Then it descends in the groove between the brachialis and brachioradialis in front of the elbow in the cubital fossa, where it divides into two terminal branches. A superficial terminal branch, which is cutaneous, which is considered as the continuation of the radial nerve, and a deep terminal branch called posterior interosseous nerve. The branches in the axilla include branches to the two heads of triceps, that is to say one muscle, the long head and the medial head, in addition to one cutaneous branch, which is the posterior cutaneous nerve of the arm. In the spiral groove, it gives to two muscles, the two heads of the triceps, the lateral head and the medial head, in addition to the anconeus, together with two cutaneous branches, the lower lateral cutaneous nerve of the arm and the posterior cutaneous nerve of the forearm. In the groove between the brachialis and brachioradialis, it supplies two muscles, the brachialis, the brachioradialis and the extensor carpi radialis longus. We will continue with the two terminal branches. The superficial radial, it begins in front of the lateral epicondyle in the groove between the brachialis and brachioradialis. Then it descends under cover of brachioradialis in the upper two-thirds of the forearm. In the lower third, it winds backwards to run in the anatomical snuff box to reach the dorsum of the hand. It supplies cutaneous branches to the dorsum of the lateral two-thirds of the hand, together with the dorsum of the lateral 3½ fingers on their proximal phalanges. The posterior interosseous, or the deep branch, descends between the two heads of supinator, or it pierces the supinator, then runs lateral to the neck of radius, then descends between the superficial and deep group of muscles in the back of forearm till the extensor retinaculum, where it runs in the fourth compartment together with the termination of anterior interosseous artery, the extensor digitorum, and the extensor digiti minimi. Its distribution is muscular. It gives all muscles of the back of forearm, whether superficial or deep, except the three, which start with A, B, E, or ABE, the anconeus, brachioradialis, and extensor carpi radialis longus. To understand the lesions of the radial nerve, we will revise its distribution, motor and sensory, Its trunk supplies the triceps plus the ABE. The posterior interosseous supplies all the wrist and finger extensors except the ABE. Its sensory distribution is through 3 cutaneous nerves above the hand, the lower lateral cutaneous nerve of the arm, the posterior cutaneous nerve of the arm, and the posterior cutaneous nerve of the forearm. In addition, in the hand, it supplies the lateral 2/3 of the dorsum and the lateral 3½ fingers from their dorsal aspect along the proximal phalanges. The lesion in the axilla is caused by crutch palsy, the older crutches which used to compress on the axilla, and there is a lesion called Saturday night palsy, which occurs in drunk people hanging their arms over the back of the chair. Its effects are paralysis and anesthesia. The paralysis occurs in the triceps, leading to loss of elbow extension, and in the forearm and finger extensors, leading to wrist drop and finger drop, as you can see here. There is no extension either of the fingers or of the wrist. The anesthesia or loss of sensation will occur from the lower lateral part of the arm, from the back of arm and forearm, and from this area on the dorsum of the hand, the first interosseous cleft, and the lateral 3½ fingers on their proximal phalanges. In lesion of the spiral groove, it occurs usually due to faulty intramuscular injections, fracture of the humerus in the spiral groove, or operating table injuries when the arm is not resting on the armrest like this and is hung on the side of the table, where the nerve in the spiral groove is compressed against the edge of the table, leading to what's called neuropraxia. The effects are the same as lesion in the axilla, except that the long head of triceps is working. Therefore, there is some flexion, some extension of the elbow, which is preserved. There is no total loss here, but the other effects are the same. In the case of injury of the posterior interosseous nerve, they occur due to fracture of neck of radius, and they lead to motor effect only, wrist drop and finger drop with no sensory affection. In the injury of the superficial radial, it's usually due to a wrist cut wound. It leads to anesthesia of the first dorsal interdigital cleft, together with the lateral 3½ fingers. Now we came to the second part of the lecture, the cutaneous nerve supply of upper limb. We will study the nerves of the arm, the forearm, and the hand. In the arm, we have 3 lateral nerves, 2 medial nerves, 1 posterior nerve. Let's see where they come from. The lateral nerves are the lateral supraclavicular nerve coming from the cervical plexus. It supplies the upper part of the deltoid. The upper lateral cutaneous nerve of arm, which is a branch of the axillary nerve, supplies skin on the lower part of the deltoid, and the lower lateral cutaneous nerve of arm, which is a branch of the radial nerve, it supplies skin below the deltoid. The medial nerves are intercostobrachial nerve in the upper half and medial cutaneous nerve of the arm in the lower half. The intercostobrachial is a branch of the second intercostal nerve. It's the lateral cutaneous branch. And the medial cutaneous of the arm is a branch of the medial cord of brachial plexus. The posterior cutaneous nerve of the arm is a branch of the radial nerve. And we have 3 cutaneous nerve in the forearm, one lateral, one medial, and one posterior. The lateral is the continuation of musculocutaneous nerve. The medial is a branch of medial cord of brachial plexus. The posterior is a branch of the radial. Regarding the hand, we have palmar in the palm. We have a palmar cutaneous branch of median nerve to the medial, to the lateral 2/3. Palmar cutaneous branch of ulnar nerve to the medial 1/3. Digital branches of median nerve to the lateral 3.5 fingers from their palmar aspect and the dorsal aspects of the terminal phalanges. And the digital branches of the superficial branch of ulnar nerve to the medial 1.5 fingers from their palmar aspect. On the dorsum of the medial 1/3 of the hand and the medial 1.5 fingers, this area is supplied by the dorsal branch of ulnar nerve, while the lateral 2/3 of the dorsum plus the lateral 3.5 fingers on their proximal phalanges are supplied by the terminal branch of radial nerve. Now we reach the end of this lecture. Thank you for listening. If you like these lectures, please subscribe to my YouTube channel and hit like. Thanks again.